Tonight, a warning for dermatologists. People have gotten seriously sick from counterfeit Botox injections. It's happened in 11 states, including here in Illinois.
So we are joined tonight by someone who has been working with cosmetic dermatology for more than 2 decades. Wow, Dr. Carolyn Jacob, thank you for being here. Let's talk about immediately the dangers and the potential dangers of using Botox.
Absolutely. So Botox should always be administered by a board-certified physician, such as a dermatologist, plastic surgeon, or facial plastic surgeon. And you really want to make sure that the person you're going to for any cosmetic treatment is well trained. Now, you need to trust in them that they're going to be using the products that are licensed and approved by the FDA. And in these cases, they were using products that were not the cosmetic Botox or Dysport or Daxxify or what have you. They were actually raw grade botulinum toxin.
Yeah.
Now, this is not a new thing to happen. There were 19 cases recently, and 9 of them were hospitalized. But in 2002, there were 4 people that ended up on respirators because they were using raw botulinum toxin from a lab. So that's completely unnecessary. In today's world, you've got choices to make. Don't go to places where they're trying to give you the least expensive cost for your cosmetic treatments. It's just not worth the risk.
Well, what are the possible side effects? Not only is Botox done properly with a doctor like you, but also you mentioned some of these people became seriously ill. Some of the side effects if you don't follow the advice you're giving.
Well, so the serious side effects that occurred in these cases by using something that's not the cosmetic form of botulinum were things like blurred vision, trouble swallowing, trouble breathing, and difficulty raising one's head. Those things should not occur ever when you're using the proper cosmetic treatments at the proper cosmetic doses. Things that could happen, which we consider adverse events, are an eyelid droop if the product is placed incorrectly. But if you're dealing with somebody who has dealt with this for over 20 years, as you mentioned, we've got eye drops that can reverse that. It's so rare.
Wow.
I've seen that happen twice in my 24 years doing this for patients. So again, it's usually rare. You might have some uneven eyebrows or dropped eyebrows if someone puts too much into the forehead and you have low brows to begin with. Those are side effects that are going to go away in the next over the several weeks afterwards. But again, that's improper placement, and everybody is really unique in the structure of their muscles and the strength of their muscles. So you really want to go to an expert who can analyze you individually.
Yeah, it's so overwhelming because there are so many websites. You go on Instagram and you see all of these different accounts advertising Botox. So what credentials should we be looking for on these websites, on these Instagram accounts?
Yeah, absolutely. Again, you'd like to go to a medical facility where they know what to do in case there is an adverse event. You want to go to somebody who's board certified and who's an injector who's been well trained. Again, dermatologists, plastic surgeons, facial plastic surgeons get this training during their residency or their fellowship, so they have the most training out of anybody. There's other very well-trained injectors as well, but you don't want to go to a Botox party. You don't want to go to somebody's house and have this done. I mean, I've been asked to do that for people and I've declined because what if they fell over because they're afraid of needles and then they hit their head on the ground and split their head open? I mean, you've got a whole bunch of other issues that could occur. So this should be done in a medical facility by a trained expert.
Yeah, Botox parties were very popular when Botox came out a long time ago, and people were doing it all the time. And then, of course, they had alcohol and things involved when the administration
You can get bruising. I mean,
Yeah,
alcohol increases bruising. Why do you want to come get something done and have a bruise for 2 weeks? But I do tell people, if you want to have a party, bring all your friends at the same time, have it done, and then afterwards go out to dinner together to celebrate.
That sounds. What about the good uses of Botox? I know people who have migraine headaches, they do get Botox for that as well.
It's wonderful, absolutely. So botulinum is approved for headaches, migraines, tension headaches, also hyperhidrosis, which is excessive sweating. So we use that on the underarms for people to help them stop sweating for 6 to 9 months. There's a lot of off-label uses that it's used for as well, but again, it needs to be done in the hands of a trained provider in a medical setting.
Compared to 24 years ago or so when you first started giving injections, it has vastly improved. I think not only the techniques, right, the technology and the ease of it, I gotta think we've learned a lot.
Well, we have learned a lot. And back in 1999 when I was being trained at Harvard, we only had Botox brand. Now we have other brands that have different nuances that may be more specific to your needs. So it's kind of more fun because we have a palette of choices to use for our patients. But again, being an expert in knowing all the differences between the brands, how to use them, your your anatomy, your muscle strength. There's a lot of ways to make this specific for each patient. And I think that's the art that has changed over the last 25 years.
It is artwork. I mean, it is a specialty for sure.
Definitely, yeah.
You know, what about these med spas? You know, you talk about having the credentials to do this, but a lot of people are going to med spas and getting several things done.
Sure, and so true medical spas should be overseen by a physician who's on site, and it varies from state to state. However, there are some well-trained people who work at what is termed a medical spa. So again, look at their training and their background. How many years have they been doing this? What are their credentials? Where were they trained and by whom? Because we are trainers ourselves, so I also educate on behalf of all of the companies to train other people to do these injectables. And we want to make sure that other people who are newer to it are doing it in the proper fashion. So I think it's important to just know who it is at the place that you're going to. There are other treatments that they do at medical spas, also should be overseen by a physician and should be cleared by a physician or a physician assistant who's well trained before you have any of those procedures done. And you want to make sure that you know all the consequences of having the treatments, the adverse effects that could happen, and what one can do to correct that if they were to happen to you.
Why do you get Botox anyway? Let's talk. Why do you get it?
A couple of things. So it prevents people from looking like they're stressed or angry. The original, literally the
Doesn't
original,
ice cream do that?
I know, it does, a little bit. Well, there's more to it, though. There's more to it than just ice cream, so it won't compounds. But it actually was shown later on that it improves people's mood. So they did a study specifically on treating the area between your brows that we call the glabella, and found that not only did it decrease the wrinkle, but people's moods were more elevated. Now that might be because of a feedback mechanism with serotonin getting higher. When you crunch down your brows, you have more of a negative feeling because that's a negative look that you're giving. But originally it was discovered and created by doctors Jean Carruthers and Alistair Carruthers. Alistair's a dermatologist, she's an ophthalmologist, and she was using it for eyelid spasm, which is another use for it. And her patients' crow's feet were getting better. So they looked at their secretary, who had this really deep crevice between her brows, and they're like, what can we do for that? So that's literally how they came up with it, and they published this, I believe, in 1991. So we've known the art of it. It's just really progressed over the last 25 years as
And
well.
it's also really cool that it's been used for migraines. I have a friend who started using Botox for just migraines, and it has changed her life.
And, and we have the reverse too. We have people that come to us just to have the treatments done because it makes them look better and feel better, but it also gets rid of their headaches, and so they notice when it's wearing off because their headaches come back. One of the other things that we do a lot of too, which is off-label but allowed, is for people who have TMJ or they're clenching their teeth and they're cracking their teeth and they're getting headaches because of that. So we can use that for that purpose as well in those muscles.
So just asking for a friend, Dr. Jacob, just for a friend, you know, what's a good candidate?
Sure. So anybody who has movement that creates creases or lines around the eyes, between the brows, or on the forehead are all candidates. And usually we talk to people now even about prejuvenation, doing a little bit now to prevent you from ever getting those lines to begin with. But some of my favorite patients come to me at 77 for the first time ever to have something done, and we can help them as well. So it's not just for the 30-year-olds, but anybody who doesn't like the way that their creases look, or they have headaches, or they're finding that people are like, why are you always looking so angry? And you're like, I'm not angry. I'm concentrating because I have all these devices
I'm too scared
now.
to do it.
Me too. I'm scared to do it too.
guys,
I'm
it's
so scared.
It's
like,
so easy. You won't-
I know. I'm like, I'm so
it
intrigued
takes
now.
literally a minute for me to do it. It takes about 15 minutes for me to explain it. So.
Wow, that was great just explaining it just now, Dr.
I'm
Carol.
better about it, but I'm still too scared.
Thank you for explaining to us, and fascinated by the different uses. It's helping a lot of people for a lot of other reasons. But now we're all self-conscious about
I
our
know,
brow
it's like,
right here.
okay, pop open.
I know, I'm not mad.
Be happy. If you can be happy, does that help? Because then you won't be mad. Like, don't worry, be happy.
Gives you a little eyebrow lift too.
Doctor, thanks so much for spending time with us. Really appreciate you. Thank you.
Fascinating. Just asking for friends. Thank you.
Yes.
I might call you later.
Watch breaking news on YouTube. Subscribe to ABC7 Chicago Eyewitness News.